I chose to specialize in hernia care and abdominal reconstruction because of the unique impact that can have on a patient's life. Hernia patients are often suffering greatly. Hernias themselves can be debilitating, and for patients who've had multiple failed hernia operations, it can be demoralizing and disheartening as well. With advancement in hernia care, we really have so many options now and the opportunity to give durable repairs so much more than we did in the past. I've just loved the opportunity to meet patients in that situation and give them a chance of an improvement. My practice philosophy is to give individualized care and do it the right way the first time. All hernias are not created equal, and all patients are not created equal. With advances in hernia care, it's gotten to the point that we have a lot of options for repairing hernias, and it's really important to pair the right operation with the individual needs of the patient. Once you have the right operation, you need to find the right modality. For many patients, a robotic, minimally invasive operation gives them the best chance of an easy recovery and maybe improved chances of avoiding complications, but for some patients, an open operation is best. Once you have the right plan, you now need to do it right the first time. We know that with hernia care, the chances of a future hernia recurrence go up with every complication and every failed operation. So the best thing that we can do is do all that we can to ensure that their next hernia operation is their last hernia operation. The first thing I do when I try to establish a new patient relationship really is to try to develop trust. If the patient doesn't trust me, we're in trouble. We have invasive things to do to try to help them, and it's very important that they trust. When I'm teaching medical students or residents, one of the things I teach them is that the best way to develop trust really is to listen to the patient. If a patient doesn't feel like you've listened to them or heard them, they're not going to trust. You may have the right answer. You may have the absolute right plan for taking care of that patient, but if they don't feel like you heard them, at one level they're going to wonder if you did have the right answer, if you had received the thing they wanted to give you that you didn't, if that would change the plan. But really on a deeper level, when a patient doesn't feel like they've been listened to or heard, they start to wonder if you're relating to them more as a project than a patient. And it's really hard to trust someone who relates to you as a project, not a patient.